Today, I'm gonna answer some commonly asked questions about veneers. I've had some people ask few questions, so I'm gonna try to answer if is veneer the right treatment for you. You know, some of the questions are, how long does it take to have a veneers done? You know, let me start there. One, you wanna make sure you go to someone who has enough training on veneers. Yes, everybody will tell you they can do veneers, but you want to make sure that whoever you're getting your veneers from know how to diagnose it correctly, how to give you a game plan from A to Z. So that's that. That being said, what are veneers? What's the main purpose with veneers? Veneers actually can address many things on your teeth, on your mouth. One, the obvious, if you don't like the way your teeth look, color, shape, if you don't like, if you have spacing, veneer can be a very good option to have all those things addressed. If your teeth are, you know, crook, whatever, you know, there is a lot of crowding, it may be the best option to have some type of clear aligners to put the teeth in the right place than veneer. So the reason is so that you don't have to cut a lot of teeth. You can do the veneers with a very minimal preparation, so that in the long run your teeth can last you for a long time, as opposed to if you cut a lot of the teeth structure. So you have to kind of know that. If you have some crowding, you know, the best way is to align the teeth where they should be, so that we can do very minimal preparation. So that would be the goal. How long would a veneer take time frame wise? It really depends. I know there are people that go get the veneer done in one day. Is it always the best? Not always the best. Depends on your clinical situation, kind of what I said earlier. If you have crowding, if you have other things, if your gum is not the best, you want to make sure that you do veneers when your gum is healthy. Okay, we don't really do veneers when the gum is bleeding. The reason being is the outcome won't be as good as it should be, right? So, but again, these are all things your doctor should be able to discuss with you, and don't do shortcuts. I know some people go, you know, into other countries, get the veneer done in one appointment, and guess what? They come right back to our offices and say, I don't really like it. It looks more chalky. I don't like the color. It doesn't look real. You know, and I've got gum bleeding and all that. I've seen those patients. I've had patients that went to Turkey. I've had patients that went to Mexico. I've had patients, because they're doing it in one visit, they think it's the best. Well, not always the best. Like I said, it is really depends on case by case. So the way we like to do our veneers is that we diagnose correctly, we discuss with the patient time frame wise, we go a test drive with a professional to make sure that the patient is happy with the color, shape, and all those things before we put in the final product, which is the porcelain one, right? So I like the two-step process because it gives me the opportunity to correct. You know, let's say if you're not very happy with the shape, we can make that shape correction. But if you do it one step, guess what? It's done. You're not gonna be able to correct anything. So those are the pros and cons, the benefits of, you know, having a two-step process or a multi-step process. It just that we are driven by what the final outcome is gonna look like. There's a bunch of other questions that we can answer. I think for today, that probably is enough. I don't want to go over some people's head, you know, but I do have multiple other questions that I would like to answer in different sessions. Thank you. If you have any other questions, feel free to write me detail and then I can answer them for you. Thank you.